Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. This parasitology lecture is about lymphatic filariasis. This parasitic disease is also known as pancreatitis, Wuchereriasis, and elephantiasis. It is caused by tissue nematodes, Wuchereria bancrofti, and this one causes the vast majority of cases. Other tissue nematodes are Brugia malai and Brugia timori. These parasites are strict human parasites. Here you see pictures of the adult male and female Wuchereria bancrofti. The female on the right and the male on the left. The adult worm is white and thread-like. The female measures from 5 to 10 centimeters long, while the male measures from 2.5 to 4 centimeters long. The vectors are the mosquitoes of the genera Aedes, Anopheles, and Culex. Here there are some information before we go to the figurative illustration of the life cycle. Once again, human is the only known host. The infective stage is L3 larva, which is found in the mosquito. The infection takes place by the bite of the mosquito that needs to take a blood meal. Meanwhile, L3 larvae enter through the bite into the skin. They travel through dermis to lymphatic vessels, and they mature into adult worms in a matter of 9 to 12 months. The adult worms can live averagely from 5 to 7 years, but they may live up to 15 years. The males and females mate, and the females lay microfilariae. These are larvae. So I'd like to draw your attention here that the female lays larvae, which are microfilariae. It does not lay eggs. The female lays about 10,000 to 50,000 microfilariae per day. Microfilariae have nocturnal periodicity in the blood, so they move from the lymphatic vessels into the bloodstream during the night, and especially in the duration of from 10 p.m. to 4 a.m. During this time, the mosquito takes the microfilariae, and the microfilariae develop from L1, that is the first stage, into the second stage, and the third stage, L3, which is the infective stage, in a time of 10 to 14 days. And this is a figurative illustration of the life cycle. So you can see also the accompanying PDF. The information about the microfilaria, it measures from 177 to 296 micrometers. And description about it, it is sheathed, so it has got a sheath, but the nuclei do not reach the tip of the tail. Pathogenesis and pathology. Pathogenesis means the mechanism of disease, and the pathology is the resulting disease. The pathology is mainly by the adult worms. Live or dead worms initiate an immune response, leading to blockage of the lymphatic vessels. that leads to lymphedema, edema due to lymphatic fluid collection in the interstitium, and the coarsening of the skin over the lymphedema is known as elephantiasis. So there will be lymphedema, which is an non-pitting edema, and elephantiasis. You can see the picture here. Also, kidney can be involved, and the lymph is voided with urine, leading to milky urine known as chyluria. Diagnosis clinically, so if you see a patient with elephantiasis, and also you may find the scrotum in the male is swollen also. Laboratory wise, you take the specimen is a nocturnal blood sample looking for microfilaria, and so microscopically you can detect the microfilaria. It is sheathed, but the nuclei do not reach the tip of the tail. Treatment, the drugs are diethyl carbamazine, ivermectin, and albendazole, any of them, or a combination. Also, doxycycline as an antibiotic is used to kill the Wolbachia. What is Wolbachia? Wolbachia are gram-negative bacteria living in the tissue nematode. They facilitate the reproduction. So killing them will affect negatively the worm. Prevention, treatment of patients, and vector control. I hope that the lecture is understandable, and I wish you all the best.